I decided to become a St. Joseph worker at the very end of my senior year of college. I really wanted to do a year of service, and I was looking at all the programs, and I saw the Sisters of St. Joseph and the St. Joseph Worker Program in Orange. I saw that they had some healthcare positions available, which I was really interested in, as well as just the idea of being a program for women, empowering each other to be in the field of social justice. So that's what really drew me to the program. My placement site was at Mission Hospital, which is a hospital in South Orange County. I actually had two roles there. On some days I would act as a health advocate. I basically did a lot of community outreach. We are working on 3 initiatives within our community benefit department. So that would be immigrant support and solidarity, economic mobility, and then mental health awareness. So just doing a lot of community outreach, education, and awareness events through that role. And then I also was an information and resource specialist at one of our family resource centers. So with that role, I kind of worked as a connector to clients who came into the center looking for services. I would help them get access to those services, whether that would be by scheduling an appointment or filling out an intake for them so that they could be seen by a mental health counselor or case management or whatever they need. The first thing would be, with my role as a health advocate, I learned so much about public health and just the implications that socioeconomic factors can have on a person's not only physical health, but also mental health and even spiritual health. You know, I did a lot of work with increasing awareness within hospital staff about human trafficking and kind of looking at it through a trauma-informed approach. So I learned a lot this year about trauma-informed care. So something that I feel really privileged to have gotten the chance to do when I was here is take a domestic violence certification course. So it was just a 40-hour course in which I became a certified domestic violence counselor. So something I think I'm going to leave behind at Mission Hospital is the work I was doing with the Human Trafficking Initiative. I worked the whole year kind of with different departments within the hospital, including emergency department, nursing staff, radiology and imaging, care management, and even the spiritual care department. And we kind of were working together to draft a human trafficking protocol. So a protocol of what to do if a nurse or a caregiver at the hospital sees that their patient could potentially be a victim of human trafficking. There's a few things I'll definitely take away with me. For one thing, I definitely have a newfound appreciation for my gift of being able to speak Spanish. I use that a lot this year. In South Orange County, there's a really large Hispanic population, and I really felt like I was able to connect with clients on a deeper level if they spoke Spanish primarily, and I could speak to them in Spanish. So I really appreciate that gift that my parents gave me. So another thing that I will take away with me is a newfound energy for being able to use the gifts that I've been given for the work towards social justice. I think I really learned what I'm good at and what maybe I'm not meant to do for the rest of my life, and that's okay. I think everyone has a role in working towards social justice for the greater community, and it's just about finding what that role is. I think my role towards social justice will definitely be in the healthcare field. I'm actually going to physical therapy school next year. And to me, that kind of means being an advocate for my patients as well as just the community that I end up being a part of. And you know, I've learned a lot about what it looks to make a sacred encounter with a patient or with a client this year, and I really want to implement that in my role as a physical therapist.